Good morning, everyone, and welcome to the last installation for 2023 of Healthy Living with Mild Cognitive Impairment. Today, we are going to be talking about personalizing exercise to boost your brain health and memory. My name is Bonnie Netkinson, and I work at the Wisconsin Alzheimer's Disease Research Center. And myself and my co-host, Jen, will be entertaining you, I guess, according to Dr. Chin, this morning. Um, Before we go ahead and get into the presentation, we just have a couple housekeeping items we'll go over and then some brief introductions. If you have a question, please feel free to put it in the chat, and Jen will be monitoring the chat, and we will get the questions answered as appropriate. And then you're welcome to leave your camera on and to interact with us. We do ask that you keep yourself muted. If something happens and you unmute and there's some noise in the background, Jen or I will go ahead and unmute you, but we want this to be as interactive as possible. We do have a few community locations joining us where people have gathered. So thank you to the dementia care specialists who have folks joining us from Rock County, Kenosha County, Brown County, and Jefferson and Dodge counties. And so, as I said, I'm Bonnie. This will be my last time as me joining you with this program. I've transitioned into a new position at the center working with dementia care and caregiver research. And so Jen, my lovely counterpart, who has been with us on this program before, is now working at the center. And this is the first Friday. So she just started on Monday. So you know Jen, but Jen, if you want to go ahead and tell them a little bit about what you're going to be doing now.
Yes, thank you, Bonnie. So I have also transitioned in my work, and I am now on the team with Nate and Bonnie and a ton of other people at the Wisconsin Alzheimer's Disease Research Center, and I'm the program manager for the outreach, retention, and engagement core of the center. So I will be taking over the reins for this educational series for 2024. And I just want to thank Bonnie for all that she has done to coordinate everything and communicate with everybody and get our satellite locations on board. We're just really thankful for all of the work that you've done over the years, Bonnie. So thank you.
Well, thank you very much. Well, we have such a great program in store for everyone today. We'll go ahead and Dr. Chin is joining us as he is the medical director of this program. So glad you could join us, and can't wait to hear about rucking as we go throughout the program. And then Jen will go ahead and introduce Dr. Braun. But before we do that, Dr. Chin, is there any thing you'd like to share?
Well, I would also like to extend, my real deep appreciation, Bonnie, for what you've done with this program. I know that those that are attending also feel the same way. There's still an open invitation for you to come whenever you want for any of these events, so don't feel like you cannot attend anymore. And then I really want to thank all of you who are here today for attending. We're very excited about this particular talk, and of course, it's always an honor to have Dr. Braun join us. It's not easy to get a hold of Dr. Braun, and so we're very appreciative, and we know she's busy. But I also just want to say that we really want feedback and input. So for 2024 in particular and 2025, if there are topics, ideas, or even changes to format that people would like us to explore, please do reach out. And how you can reach out to Jen with that feedback. And we're happy to hear that and see how we can make this a better experience for everybody. All right. Thank you.
Awesome. Well, thanks, Nate, and thanks, Bonnie. And it is my pleasure to introduce Dr. Michelle Braun. I've known Michelle for several years now. We have partnered on multiple projects, and she's amazing in a number of different ways. And so I just want to introduce her to you if you have not if this is your first time hearing Michelle present, I know that you will enjoy it, but she presents on a number of different topics. She is a neuropsychologist out of the Ascension Healthcare System, and her base is in Racine County. She is also a facilitator of a support group for caregivers who are dealing with frontotemporal dementia diagnosis of a loved one. And she is an author of the book High Octane Brain, which is, I believe, on the bestsellers list. And she is just a wealth of knowledge and information about all different types of dementia, the importance of addressing and keeping in mind our cognitive health. And today she is going to present on the topic of personalized exercise to boost brain health and memory. So Dr. Braun, I'm going to hand it off to you. Thanks for being here and welcome.
Thank you so much. It's so awesome to be here, and it's great to be here at this historic day where Bonnie is passing the baton to Jen, and this is really amazing because Bonnie, I've been really just blessed to work with you, for years now in the context of presentations, and your work has been amazing, and it's reached so many. And Jen, words can't express. I mean, we've worked together, like you said, for years, and so this is amazing to have this be an inaugural event. So thank you. And thank you, Dr. Chin, for all that you have been doing over the years to outreach to individuals with mild cognitive impairment, with Alzheimer's, individuals who really just want to also maximize their cognitive health proactively. And I was sharing your information, Dr. Chin, in Boston just last week. And so really kind of encouraging, saying, hey, this is really amazing, that Dementia Matters podcast, all of the resources. So I'm really heartened to see so many folks here, not only locally, but also nationally as well. So thank you for joining us. And so we're going to talk about a topic that's near and dear to my heart. And I know that a number of us who have worked with individuals who have mild cognitive impairment and across really the cognitive continuum, have really talked a lot about this need to personalize exercise, because I don't know about you, but when we hear that word exercise, there's a lot of connotations that come, many of them not so positive, because it's work and it has its sort of roots in effort and time, and I often see sort of a glazed over look if I use that word. So we're going to talk about the use of verbiage with that idea of movement with joy, this idea that we can really reclaim and rename exercise in ways that are important to us and that speak to our heart and speak to what really energizes us. And so let's reclaim that here together in a way that is meaningful to you, and show you some really cool research in the meantime that supports just how vital this is for minimizing and in some cases halting the progression of cognitive impairment in the context of mild cognitive impairment. So we're going to talk about personalizing exercise, of course, but I want you to all leave here today with some really good ideas. I want to consider this almost a working session together here. So if you don't already have a piece of paper and a pen or some writing utensil, I'd like you to all get one out right now. I've got mine right here, ready to go. Because this is really designed to be something that you leave with your individual prescription, so to speak, at the end of this talk. And so it'll be fun if you all want to hold up your paper and pen or writing utensil as you get it. I'm kind of scrolling through here to see. So I see some of you already are holding it up. Yep, got it. Awesome. Those of you who aren't on camera, if you want to pop on and show us your pen and paper too, if you'd like, we'd love to see that. Get a little bit more energy here in the group as we're all kind of working together on a shared goal, which is to leave here by 11:30 Central Time here with this paper having some information on it that's personalized to you, that you really feel like you can act on. And so that's really the exciting goal that we have in front of us today. So let's talk a little bit about brain health itself, just to start at the macro level a little bit. So we are here partially because brain health is not only just a priority in our own lives, but is actually a worldwide priority. And so we see this happening in a number of spheres. Obviously, for older adults, we know that we are looking at a doubling of the older adult population by 2050, almost inconceivably, in tandem with a tripling of Alzheimer's disease. And so we are sitting at around 6 million individuals in the US right now who have been diagnosed with Alzheimer's, about 47 million worldwide. And we will see, again, almost inconceivably, a tripling of those numbers projected here in this next decade and a half. So, or a couple decades rather. So this is really fueling a great concern about cognitive health. And so, as you'll see here on this slide, about 75% of adults are worried that their brain health will decline, but they want to improve it. And so that's why presentations like this are so important, because we really want to give you the tools, the science-backed tools, to enhance brain health. And many people do fear Alzheimer's more than any other disease. And this has actually been shown in a number of different surveys where we see Alzheimer's coming in at number one, above cancer, above a number of other diagnoses that people do fear. I also wanted to I know we're here, we're going to delve into MCI, we're going to talk a lot about exercise, but I really wanted to talk a little bit about how ubiquitous this concern of cognitive health is across the lifespan. And so I was, sometimes when we go to national conferences and we talk with others and we really get the pulse from other areas of the country. And I just happened to be in Boston a week ago today, presenting on cognitive health. And at that presentation, talking with a number of folks who were really saying, you know what, this is something that we are seeing be at the top of the priority list across the lifespan. For children, it's really becoming a focus to be proactive with cognitive health. But in my practice, where I see adults of all ages, 18 and up, I specialize in memory disorders and dementia, but my practice is open to all adults. And in this last couple of years since the pandemic has subsided for the most part, the number of young adults coming in who are reporting significant cognitive concerns has really just skyrocketed. It's probably quadrupled in this time. And so this actually goes in line with a record number of younger adults, ages 18 through 64, according to brand new census data, for the first time ever reporting more cognitive concerns than ever before. And there are a number of reasons why that may be, and I know that that's a bit of a different discussion, but the import of this information is something that you can share not only, with your loved ones as you yourself are trying to create a program for yourself, but also with others in your family. The research is really clear that if we can get brain health initiatives in line early on and have that be a part of our lives, just like brushing our teeth, just like anything that we are doing on a daily basis to take care of ourselves, that we can really move the needle when it comes to dementia. So one stat that I like along those lines is if we use these lifestyle factors as this population of older adults is growing, and we can delay the onset of Alzheimer's disease by just 1 year, which is extremely doable with these lifestyle techniques, we can reduce the amount of cases by about 1 million by 2050, which is huge number of lives impacted. There really is a growing salience for the impact of lifestyle factors, which brings us here today to talk about, the power of some of those factors, most importantly, exercise. And so there's been a shifting paradigm for many years now with regard to how important lifestyle factors are, and it's really grown in importance. When I started doing these talks back in 2005, after I finished my postdoc, at that time, we had really good data on lifestyle factors, but we didn't have randomized controlled trials. We had what are called longitudinal studies and cross-sectional studies. which were really convincing, and hundreds of those, you know, in the interim have grown to support lifestyle factors. But I'm really excited to talk to you about some randomized controlled trials today, meaning the gold standard way we have of measuring cause and effect as much as possible that really do support these initiatives. So really strong science here. There's also some strong science for looking at Alzheimer's disease, of which mild cognitive impairment is sometimes progressing too. From the standpoint of dementia, there can be underlying Alzheimer's disease that causes mild cognitive impairment. But there's really this growing understanding that this is a chronic condition in many ways. We see cellular changes happening sometimes decades prior to diagnosis, sometimes 30 to 40 years prior. So when we know that trajectory of our cognitive health, if we conceptualize that across decades, that really gives us added incentive to address these issues as soon as we can. It's never too early, it's never too late. I want to also speak to the importance of exercise in the context of all of the competing products and services that are out there that have pretty strong claims that they can be just as helpful for brain health. And just put the caution flag up on some of these. So the first is supplements. There have been several consensus statements from the World Health Organization, from AARP, from a number of large groups who really pore through the data that have been very clear that unless someone is nutrient deficient in a specific nutrient, which does not happen too much if you're eating a well-balanced diet, that there really is no evidence that supplements, even including multivitamins, fish oil, things that on the surface, ginkgo biloba, might seem to be very helpful for brain health, have any impact on brain health. So that's a different talk, of course, but I did want to share with you that we have to really look at the scientific support for some of these other strategies, because it really does then increase our focus on the strategies that do have support. There is unfortunately a growing focus on what I would call a personalized nutrient blend approach, which is actually unfortunately promulgated by a number of healthcare providers, actually, who have written books about the impact of, for example, detoxifying a system of lead and then adding these personalized nutrient blends based on blood tests. And that really has no replicated support, and it's extremely expensive. And this is another thing that people are really trying to put their hopes into, but really hasn't shown, you know, significant support. We would be gratified if we could tell somebody to go get a supplement or go get a personalized nutrient blend. That would be fantastic to have that in the toolbox, but the science just isn't there right now. And the same with what we call restrictive brain health diets, where, for example, someone is told to not eat carbs at all. Again, no support for that. So it's important to look at the tapestry, especially because some of these inputs and marketing areas are increasingly coming in, and I see this with my patients every day. They're coming in and they're doing these things at the expense of doing things that could really actually be helpful. And again, that's not anyone's fault. The marketing is slick. It's very convincing. And especially if you have somebody who has credentials saying that these things are helpful, it can make it harder to figure out what is actually helpful. So let's take a moment and look at the concept of, again, of a brain health trajectory. And this is the idea that all of us come into the world with inborn traits, and those include things like our cognitive ability, our sociability, our genetic factors. All of those are given to us at some level. And then, of course, as children, we are not directly able to modify things like our education, our environment, whether or not we may have had an injury, et cetera. So those things are sort of set in motion early on, but through something called epigenetics, which is basically a way of using behavior to modify genetic expression and even the expression of early lifestyle experiences, we can see that you can imagine yourself on a continuum, on a trajectory of which you have some control, regardless of your genetic factors. And this has been shown in the context of even the 1% of cases of Alzheimer's disease, which are familial dominant, meaning that a person is definitely going to express the disease. It's just a matter of when, that we can see that those individuals who engage in exercise are able to move the onset of Alzheimer's back by 15 years, which is amazing. So again, we see this interaction with genetic factors and lifestyle factors all the time, and it's really empowering. So I want you to imagine that what we're doing today is we're taking wherever you are right now, and we are really trying to get on that healthy aging trajectory so that even if you have already expressed symptoms of mild cognitive impairment or dementia or not, we're trying to push back the intensity of those symptoms and lengthen out the amount of time you have with better cognitive functioning. In other words, even if there is projected cognitive decline in the context of mild cognitive impairment, we want to slow that down. And the research is pretty clear, and I'm going to show you some really good information on that with regard to exercise. A really promising study that just wrapped up showing us that we actually can do that. So again, we're aiming for that healthy aging trajectory no matter where we are today. It is not too late to start. We can get onto that trajectory. Let's take a step back again, though, and think about the bigger picture about your brain. It really is this living miracle, essentially. I mean, it's really cool because it's 3 pounds if you were to hold it, if you were to actually have a brain, to hold, but it decreases its weight to less than half of the weight of an egg when it is suspended in its cerebrospinal fluid, which is pretty amazing. So you've got this amazing organ that's kind of weightless in a sense as it's buoyed in your body. And it's the consistency of Jello or pudding, yet it is responsible for all we do. And it's pretty amazing to think about specific areas of the brain in particular that are really the powerhouse. So we're gonna talk especially about the hippocampus, which is in the medial temporal lobe. So one of the things that I have found most helpful over the years of trying to communicate about the benefit of exercise is to share with you that when we can help people get really concrete and sensory about the hippocampus, that seems to be a spark for people. So let's try that right now. I want you to use your ears as a landmark, go about 1.5 inches in towards the center of your head, and you can see that's about 1.5 inches in. You're going to see a little curled thumb-shaped structure called the hippocampus, and it really is about the size and shape of your thumb, and it's curled kind of, and the name hippocampus comes from the root for the word seahorse, and it is kind of a little seahorse shaped. Why that's such an important part of the brain and why we're going to focus on it with exercise in particular is because that is your memory switchboard. That is where right now, if we were to measure the activity in that area, it is bustling with information as we're learning about these different topics here. The hippocampus is kind of like a post office. It takes information in at an extremely fast rate, and it packages it and it sends it off for storage. And this is also ground zero for where we see Alzheimer's disease first be expressed in most individuals, which is why memory problems are often the initial symptom of Alzheimer's. It's because that quick storage and assembling and packaging is becoming slower, and getting it sent off for storage is also becoming much more laborious because of the cellular changes there. And so another way of visualizing the hippocampus is to look at a section of the brain. So here we're kind of cutting straight through. This is a little section where you can see the hippocampus, again, imagine the ear is here, and this is about 1.5 inches in towards the center, and you can see some atrophy in that area of the hippocampus. Whereas on this side, you see this nice gray matter area that looks very dense. This is what we're after with the strategies that we're talking about today with exercise, because the data has been very clear that when we engage in exercise, again, we're including individuals who have mild cognitive impairment, individuals who have Alzheimer's disease. That's the cool thing about exercise, is you see these benefits in brain tissue and cognitive function through engagement in exercise, meaning that there is less atrophy over time for individuals with mild cognitive impairment who engage in exercise than individuals who don't. And so that's what we're after, is, again, that healthy aging trajectory. So now that we've taken kind of that big picture look at the structure of the brain, let's turn our attention to some of the studies that we really look to and use as evidence for these randomized controlled trial supports that I was mentioning. So many of you have probably heard of the FINGER study. And the FINGER study was the first randomized controlled trial that showed that multimodal interventions, including exercise, a brain healthy diet, cognitive training, vascular risk management, this should say 1,260 individuals, not 2,500, were able to reduce the rate of cognitive decline after just 2 years. By 30%. So that's really a very impressive statistic. The cool thing about FINGER is that the benefits are continuing to be tracked now. And those benefits held up after 2 years. And the really great part about this, we get a number of individuals coming in for neuropsychological assessments who have a family history of Alzheimer's or are suspecting that there may have been undiagnosed Alzheimer's or another dementia in loved ones. And the great thing about FINGER is that even those individuals who have a genetic risk for Alzheimer's, specifically the ApoE4 allele or alleles, had a 30% reduction as well in cognitive decline. In other words, they had about the same, and in some cases, maybe even greater benefit from that multimodal intervention, which is very, very hopeful, meaning again that regardless of genetic factors, we can benefit from these strategies. The really neat thing about FINGER as well is there are, in the cells that we have, a part of the DNA strand called a telomere, which is kind of like the cap on a shoelace. It's the end of the strand of DNA. And over time, as we get older and our cells replicate, we see that those telomeres shorten. And that's actually, telomere length is actually associated with aging. It's a measure of cellular aging. The interesting thing about FINGER is people who had shorter telomeres or increased cellular aging actually show greater benefit from the multimodal intervention. Again, meaning that it is never too late to try and slow down that more accelerated aging process. Now, FINGER was done with a Finnish diet, very specific, a Nordic diet that was very specific to the foods of that region. And so, as many of you may know, the Alzheimer's Association is now using a more of a sort of Western approach, including the MIND diet, along with the other interventions that we talked about, to look at a diverse US population and how we can use a similar multimodal strategy to benefit brain health here in the United States. So that's exciting. And it's also super exciting that we recognize that there is no one size that fits all when it comes to interventions for brain health. We have to really be cognizant of the idea that there's support for Japanese diet, Argentinian diet, lots of different cultural diets for brain health, and studying that in the context of exercise that's also, or physical activity, movement with joy that is culturally specific is also important. So we see that going on right now through worldwide FINGERs, which is essentially like FINGER being studied in a number of other places. So this gets at the heart of why we're here today as well, which is there is no one size fits all prescription for brain health. And we really want to drill down and find what your individual prescription is. So let's take a look at the scientifically supported strategies to slow the progression of mild cognitive impairment to Alzheimer's dementia. Now, importantly, for any of you who have seen any of the Boost Your Brain talks I've given, where we talk about strategies that slow normal cognitive aging, these are slightly different. So we have different strategies that slow the progression of normal cognitive aging versus MCI to potential Alzheimer's dementia and then slowing Alzheimer's dementia itself. But the good news is exercise is at the top of the list of all three of those different stages, which is what again brings us here today. So in mild cognitive impairment, I'm going to show you the data, but these are kind of the top line take-home messages. Aerobic exercise decreases levels of tau, which is an intracellular protein that starts to go awry in Alzheimer's and starts to make neural transmission difficult. So it decreases those levels, and it also decreases the shrinkage of the cortex, which is pretty amazing. In other words, we can see that on brain imaging, and you're going to hear a little bit about that from Laura Baker, who is the basically the primary investigator for one of the greatest trials we have of randomized controlled trials in mild cognitive impairment in a few minutes. I'm going to play a video of her telling you a little bit about that. It was really exciting. You know, you're also going to hear the take-home message today that although we talk a lot about aerobic exercise and the power of that with regard to slowing brain aging and Alzheimer's disease, so there's more support generally in those bookends, so to speak. In MCI or mild cognitive impairment, we see support for not just aerobic exercise, but also for lower impact exercises like stretching, balance, etc. And so that's really wonderful too, because many individuals prefer that type of exercise and maybe physically find that to be something that they have to gravitate to for movement safety, for keeping, pain at bay, etc. So take-home message here today is that in the randomized controlled trial of Exert, which looked at aerobic exercise versus strength, pardon me, not versus strength, but versus any kind of flexibility and balance. So those two groups showed equal slowing of their cognitive progression of the actual MCI process. So they didn't show any changes after a year on cognitive screens, which is pretty amazing. And they were compared to a control group that did show expected decline on cognitive tests. So really, really great information. Now, the cool thing about exercise is it also serves as the foundation for engagement in other lifestyle factors. So when we see clinically is when people start to exercise, they also start to do other things that are helpful for the brain. And there are some synergistic effects with a brain healthy diet and also mindfulness, which is stress management, which we'll get to a little bit later. So again, in summary, exercise is the most supported lifestyle factor that we have. Asterisk by that, it's also one of the most studied. So there could be other lifestyle factors that are also, emerging that are really important. But from the information we have right now, it really does top the list. Let's also take a look at another strategy that I often use with individuals to try to just declutter the brain health recommendations. Because if you were to go to Google now and type in brain health, you're likely going to see hundreds of different things that you could do to maximize your brain health. And honestly, when I have seen that people come in and talk about that, they're excited about it, but they're also just overwhelmed and they don't know where to start. We all have limited time and resources. And so part of my focus for many years has been, how do we simplify the recommendations to make them easy to take away and act on, but also give you the most powerful things first? So let's front end load the recommendations in a way where we look at what is the scientific support. And to that end, I came up with an acronym called Excels that takes the top 5 science-backed strategies in order of the existing support and gives you a way of remembering them. So EX is for exercise, which is obviously where we'll focus today. C is for consume brain healthy foods. E is for engage and learn. L is for lower stress to boost well-being, and S is for sleep. So like I mentioned, because exercise is the foundation for engagement in other strategies, we're going to also talk about a couple of these that are directly linked to exercise, like the consuming foods, lowering stress, and then the sleep piece, because we see changes in those with engagement. And so that brings home this lower bullet point here, which is there's a synergistic impact from multiple techniques. And meaning that you get more benefit by combining these techniques in general over time. So I know that's a lot of information. I've been talking for quite a while, and I wanted to just pause for a moment. I do see some information in the chat before we get into all of the really cool data on exercise. Jen, I wanted to just pause and see, is there any questions at this point?
Yes, we had a question come in. Has anything been shown about the benefits of steam rooms and or sauna use in helping an age-related cognitive impairment due to the toxic purging while sweating and or due to the help in cardiovascular health?
That's a great question. I haven't seen anything directly studying that in particular, but to your point, there can be offshoots of that process that I think could be helpful. So I think there's probably the most support for lowering stress by being in in a room where you're relaxing, maybe you've got that steam going, you're starting to feel calmer. So we would look at maybe reductions in cortisol, which is a stress hormone that actually can inhibit the hippocampus. So I think there's probably the most support for that from my understanding.
Thanks. Here I can resonate with this question regarding low impact exercise, because I'm not able to do the same kinds of aerobic exercise in my 50s that I used to do in my teenage years. So,
Sure.
does low impact exercise also slow cognitive decline for someone with Alzheimer's disease, not just mild cognitive impairment? Or is aerobic exercise more recommended for somebody with Alzheimer's disease?
That's a great question. And it depends. It depends what your endpoint is. So if we're talking about an individual who has a risk, for example, for falling, they can often benefit from a low impact, stability-based and flexibility-based exercise. So it depends on what the goal is. If the goal is to, for example, increase safety of mobility, that's where we would see the lower impact exercise be supported. If the goal is to decrease the brain atrophy that occurs with Alzheimer's, there is the most support for aerobic exercise. And there's more support in general for greater intensity aerobic exercise. Obviously, there's a catch-22 a lot with that, right? Which is a number of individuals who have Alzheimer's dementia may not necessarily be motivated to engage in exercise. And so we have a whole level of things we can talk about on that in terms of how we disguise exercise, how we have oftentimes a caregiver not say we're going to go exercise, but say, could you come with me? I wanted to show you this. So you're essentially flipping, the focus oftentimes on the caregiver, having the person accompany, or having a pet involved, engaging in walks in areas that are pleasurable. So there's a whole number of things we talk about, but in general, that's the research.
Awesome, thanks.
Mm-hmm.
This one kind of is in line with that low impact. The question is, what about slow pace on an exercise bike? We oftentimes think of aerobic exercise as, like we talked about basketball, volleyball, Zumba, those things. But sometimes we have to adjust the type of exercise that we're doing. And so maybe getting on the bike, like you said, is better for a particular person, or other types of slower pace exercises. How do those fit into the picture?
Well, certainly in the context of mild cognitive impairment, they've been shown to be just as helpful as more vigorous exercise. And as we'll talk about, and you're going to hear directly from Laura Baker, who was, again, the primary investigator in that study, that was actually one of the biggest surprises of that study, was that individuals who engaged in lower impact exercise, and in an exert, they studied moderate intensity aerobic exercise versus stretching, balance, and flexibility. But given that there was signal found in both of those, I think it stands to reason that any kind of movement is therapeutic, even that lower impact. Dr. Chin, did you want to weigh in on that too? Not that you have to, I just saw you you were on, so if you wanted to.
Michelle, I've been responding to some other messages too while you've been talking.
Oh, great.
No, I completely agree. I really like the way you phrase movement with joy. I always think it's better to be moving than it is to be sedentary, and we do what we can with what our body allows, and not to overdo it, because to be set back by an injury or a fall or something more serious like a fracture, and so we just have to be accepting of what our body will tolerate at the time. And certainly with more movement, I think one of the interesting things is people become more physically capable. And I say that and that's a good thing and a bad thing. One of the things that maybe you'll talk about it is that as you become more physically able to move, you would actually presumably need to do a little bit more in order to get that cardiovascular benefit, because your body can handle more. But then on the flip side, you do what your body allows you to do. And so people don't have to be swimming laps in a pool or sprinting. You can do low intensity, low impact activities that still get your heart rate going and still have your blood flow. And so I completely agree with everything you've said. And I think people just, these are all guidelines, and this is why personalizing it matters so much.
Yeah, absolutely. And I love your point about, we're always trying to strike that balance between safety and joy. The last thing we want is for any of these recommendations to lead to a fall or to lead to an injury. And so it's better in general to, just like Dr. Chin said, to make sure you're following what your body is allowing you to do. And then over time, you can notch it up a little bit if you want, but there is a wisdom in that. I think there is a great wisdom in what our bodies allow us to do. And so rest assured that following that is research supported. Jen, anything else that jumps out?
There's a number of questions in the chat right now that are not necessarily specific to they're more general questions. So I think I'd like to keep those till later. And if we have time to address them, we certainly can. But everything, I think I've caught everything related to what you have been talking about.
Can I jump in 1 second before Dr. Braun continues? While Dr. Braun was talking, I Googled that question about the sauna, because I've been hearing that a lot out in the community too. And of course, it's from Finland. There are a series of studies in Finland where they are starting, and these are large numbers, and they're not clinical trials the way Dr. Braun was just explaining. That's the best study. They're just looking at observations and asking these questions. And they are showing that there could be, and that's why it's not definitive, there could be this benefit of saunas. But what they actually go further and say is, like Dr. Braun is mentioning, maybe it's really just a reduction in blood pressure, a reduction in cortisol, a reduction in inflammation from being in the sauna and that environment and that lifestyle. And so they are there. It looks like there's about 3 or 4 studies from 2018. I think the more recent one is 2021. Looking at this. Frankly, I would love to be a participant in these particular studies, and they're saying there may be a relationship. It doesn't, if you're a person whose other medical conditions don't exclude you from being in a sauna, it looks like they were eligible for these types of studies, but it isn't something I would say, we'll do this specifically for your brain. It's more, there might be some secondary benefit if you're already doing that. So.
Yeah, that's wonderful. It's great I love those studies too, because that's really how, we advance the science, is when we have those studies that say, hey, is there a little signal? And then of course we look at it, in larger ways. But I think that idea of doing things that give you relaxation and that can promote an anti-inflammatory response is key. We're going to talk a lot about inflammation. There's a lot of convergence along that concept of inflammation and how important it is to reduce it. And exercise is a great way to reduce inflammation, along with dietary changes. Now, in the interest of really wanting to get to the heart of today, which is about personalizing this for you and having you leave with your personalized plan of action, I'm gonna summarize the research here. We can always come back if you have more questions, but I want to move this to the point where you can kind of get busy and think through this with us. So bottom line is that hundreds of studies, let's go to the bottom line here, show exercise is related to not just a reduced risk of dementia, not just a reduced rate of decline cognitively from the standpoint of testing, but also structurally in mild cognitive impairment. But there's increased volume in brain regions related to memory, attention, and mental flexibility. Now, the asterisk I'm going to put by that, when we say increased brain volume, we have to qualify that a little bit. In the context of mild cognitive impairment, there would be, in many, but not all cases, an expected decline in brain volume, just as there is in normal aging, but perhaps at a little bit of a faster rate. So we're not saying with this data that those areas grow beyond, normal age-related change. We're saying that they slow the pace of decline, meaning they shrink at a slower rate. And that's what we're really after, again, with that whole trajectory of healthy aging, is to shrink those areas at a slower rate. The same way as with cognitive functioning, we want to shrink the cognitive decline have that happen at a slower rate as well. We go back to the hippocampus, which is again ground zero for where we see Alzheimer's related changes start, but it is also the place where we see preferential change in the brain, which is amazing. So if you ask most people on the street, what is the benefit of exercise for the brain? They'll say things like, well, you get increased oxygenation and blood flow to the whole brain. And that is absolutely true. You totally get that. And that helps with neuronal functioning. It helps with angiogenesis, which is new blood vessel formation. But what's interesting is when we look at that question in the context of brain structure, we see that the hippocampus loves exercise. It's like Miracle-Gro for the hippocampus. So we have a left hippocampus, which is a little bit, for most people, more focused on verbal learning and memory, and a right-sided hippocampus, which is a little bit, for most right-handed people, focused on nonverbal memory. And we can see here on this top graph that over time, in this case, the stretching group, now this was in a normal population, not an MCI population, had normal age-related decline in their hippocampus, right? Over 6 months, over a year. So this is measuring the volume of the hippocampus. In contrast, individuals who were 65 and older, who were engaging in 2 to 3 sessions of cardiovascular training, aerobic training, showed an increased volume. Again, this is in a normal sample. So we saw that on the left and the right hippocampus, but importantly, other brain regions did not show that increased density. So the caudate nucleus, which is involved in motor functioning, you can see there's not really any increase there in the density. It's pretty flat. And you can see that same pattern here in the thalamus, which is a sensory relay area of the brain. So the take-home message here is the hippocampus in particular, and other research would show the frontal networks that connect the basement area of the brain to the frontal lobes, are the areas where we see the greatest density in improvements with exercise. There was a study, this was not a randomized controlled trial, but I like this study because it did a good job of parsing out different groups. And it showed that this is that synergistic effect that we were talking about. Exercise, when combined with the DASH diet, which is a diet for hypertension, reversed 10 years of brain aging and slowed brain aging. So this was on a group of individuals with mild cognitive impairment who did have cardiovascular risk factors like cholesterol issues, and broken into 4 groups. So we had aerobic exercise only, diet only, aerobic plus diet, and then weekly heart health education. So we see that out of all of those, group 3 with both of those components benefited the most. And so again, we'll come back to that synergistic piece, but the take-home message for you is we want your personalized prescription for exercise, but we welcome the other pieces that come with it as a result. And you can benefit from, again, adding in some dietary changes, having the better sleep, having the lower stress that comes with it. Let's turn a little bit to that EXERT trial. EXERT is the first randomized controlled trial for mild cognitive impairment that looked at exercise. And as I mentioned, the bottom line finding was that after 1 year, the global cognitive functioning for participants, about 296 participants, did not decline. In other words, we expect for mild cognitive impairment for most individuals to show some decline over time. And after 1 year, there was no cognitive decline in either the stretching group or the aerobic exercise group. So I'm going to turn to a video here and show you. So this is, again, Laura Baker. She's talking a little here about the impact of the EXERT study, and I really wanted to leave time for this. It's several minutes. It's, I think, about 8 minutes long. So kick back and relax, but everything she says is worthwhile here. So I want you to just take a listen here. This is really coming directly from the perspective of one of the masterminds of the EXERT study.
What I'm going to be showing or sharing at the AAIC meeting is a couple of different things. We have some summary points. So number one, we found that you can get people with mild cognitive impairment to stick to a 12-month intensive exercise program. And by intensive, I mean you have to work 4 times a week. You have to show up. You have to do this. We had in our final enrollment number was 296, so I'm very proud of that. This is 4 short. But of our 296 people in 12 months, they completed 31,000 exercise sessions.
We can't see the video, we can only hear it.
For me, that is a success
okay.
already, no matter what, because with mild cognitive impairment, they have their challenges every single day. Getting from point A to point B is not the same as it is for people without mild cognitive impairment. So they're daily challenged, and they were able to work in the exercise. So to me, that's an important part that, what I'm going to show you is that there was.
So you're not able to see it? No.
Correct. We can hear it, but not see it.
Yep.
Okay. Well, does anyone have experience in shit? Because I usually am able to, let me see.
Can you try to share the screen that it's playing on?
I will try that. Sorry about this, guys.
Par for the course.
Let me try this again. Are you able to see me kind of rifling through my selections here or no?
No, you stopped
Okay.
screen sharing.
Okay, let me see. Let me try this again. I think this may be, are you able to?
Now,
Yeah, now we can see the.
Okay,
Yep.
Sorry about that. My apologies. Sorry So are you seeing it still? You seeing it come to?
We're seeing it, but we're not
What I'm
here.
going to be
Oh, there
showing,
it is.
sharing
Good.
at the
Yep.
AAC meeting is a couple of different things. We have
Now we're not hearing it. So I don't think you can mute yourself, Michelle.
month intensive exercise program. And by intensive, I mean
Good.
you have to work 4 times a week. You have to show up. You have to do this. We had in our final enrollment number was 296. So I'm very proud of that. This is 4 short. But of our 296 people in 12 months, they completed 31,000 exercise sessions. And I think, for me, that is a success already, no matter what, because with mild cognitive impairment, they have their challenges.
Are you guys hearing that okay?
Every single day. Getting from point A to point B is not the same as it is for people without mild cognitive impairment. So their daily challenge, and they were able to work in the exercise. So to me, that's an important part that, what I'm going to show you is that there was benefit. So, and the question you always say, well, will they do it though? And my first point is yes, they will do it. So number 2, we did this trial during a pandemic. Only half of our participants had exited the study at the time as of March 2020, which in the US really hit us hard. And so we had to pause the study, but we stayed in touch with our participants. We called them every week, make sure they were still exercising. They would report, oh my gosh, I'm not going to stop my exercise. So they kept exercising. And then once we restarted the study, many of the YMCAs were closed. And so we're in the middle of the study. How are we going to keep them exercising? It's their medicine. So we did all kinds of things. Our trainers met them outside. We had virtual appointments. We had virtual training. We sent them to other video classes, but we still checked in with them to make sure they were still doing their 4 sessions per week. So this is another main message: is you can not only get them to do this, people with mild cognitive impairment, but you can get them to do this in a pandemic, during a pandemic. And that's, for us, this is, life. We had a pandemic, and when it passes, these people are going to deal with many other daily challenges in their life. It's just part of the disease. And so for me to show that we have a positive signal, even during a pandemic, means it could be a sustainable finding in the context of other challenging life events. So pandemic part to me is important for generalizability. Okay, so what do we find? So as a surprise to us, we found neither group declined over 12 months. The people with mild cognitive impairment, we went into the study expecting 12-month declines for some people. It's the natural course of the disease. And we're using how we're measuring decline. We have our global composite score that's been validated. It's called the ADAS-COG exec. So we added executive function for the reasons I talked to you about earlier. But so it's ADAS-COG exec. It's been published. So it's our global composite. In the stretching and balance group and in the aerobic group, they both remained stable for 12 months. So we're thinking, well, is this just because, is there something, maybe these days in COVID and in these times, people don't decline like they used to. Maybe there's just no effect and it didn't change at all. So what we did is we had a comparison group, a usual care comparison group, and we used ADNI. ADNI is a Alzheimer's disease neuroimaging initiative, is a longitudinal observational study. It's like usual care. And what we did is we went to that study. We found participants who were just like excerpt participants in terms of their age, their sex, how impaired they were at baseline. So many different components of excerpt. We matched the 2 groups. And then we looked at these people in ADNI and said, do they change over 12 months on our same measure? Yes, they all got worse. But our participants who participated in one of those 2 interventions did not. So it makes us feel better that it's not that there was no effect, but it really is that either intervention was enough to slow or stop progression on average for these individuals. I think a key ingredient is all of our people were sedentary coming in. So, what we see is that any change, so these people went from zero, they had no exercise, to they're both doing regular exercise for 12 months, completing 31,000 sessions. When you start at sedentary and you add exercise to your life, regardless of what type, your cognitive decline stops. And so we're continuing to look, at other measures that we have, but so far all signals that we look at, no matter what test we're looking at, we have other tests, are all seeing the same thing, that there's no decline in these people who should have declined. So this opens the door for anybody who's willing to increase their activity. And our amount of time, the recommendation we're going to put out is the amount of time our participants in both groups exercised was about 120 to 150 minutes per week. That is what our recommendation is going to be, is that for people with mild cognitive impairment who are sedentary, we are suggesting an increase of 120 to 150 minutes per week of any type of exercise. Whatever's going to work for them, whatever's going to feel good for them, is going to be a risk reduction strategy. And so for me, the public health implications is that this is doable for everybody. If it was only aerobic, we're going to leave out a lot of people. Probably 75% of people are not willing to be willing to do that. But if it's any kind of exercise, that's possible. And the last point I want to make is this: our intervention involved a lot of support. And so, what I would want to see is the standard recommendation going out to clinicians that you need to get your folks, exercising. Well, that's great, a great idea. But we have learned, and for all my studies, this is always true, you cannot expect someone with mild cognitive impairment to go exercise on his or her own. It's not possible. And if you expect them to exercise on their own, this program will fail. It will absolutely fail. And it's possible that it's the support element to this that is synergistic with the exercise to give them a boost. And I feel like it's that message that really needs to go out there. I hear over and over from clinicians that they're trying to get their patients to start exercising more. But, in MCI, mild cognitive impairment, your ability to initiate and organize and get going on new projects, that's what's impaired. And so to ask someone to start exercising without support, these folks just don't know how to do it. And if they can do it once, they can't sustain it. And so I think that is really a critical ingredient on any recommendation. It has to be supported, not necessarily by a trainer, but it has to be some buddy system, something where someone is with that person to help them stick to the program.
All right, so I'm going to just toggle back over here to where we were. Are you guys seeing my screen from the PowerPoint? Nope.
Correct.
Okay, no problem. I will figure this out. Any questions for, while I'm getting reset here? Any questions that anyone has at this point on Exert? This is pretty powerful study here. So as I mentioned, we'll get to the heart of the prescription for each of you, but there is some information from now this is the cardiovascular perspective. So for those of you who wanted to do more aerobic exercise, as was mentioned, there is a focus on 150 minutes or anywhere from 120 to 150 minutes a week. And so we have some data here on how you can measure intensity. Again, in Exert, that aerobic group was doing more moderate intensity, which would mean that if we use that portable talk test, the person is able to talk but not carry a tune. So when someone is huffing and puffing enough that they can't sing consistently, that's usually associated with about a moderate level of intensity. So that's where we might want to think about for those of you who are kind of seasoned exercisers already, or already using your body consistently at around that amount. So we don't want to shoot for that necessarily if you're moving from more of a sedentary type of lifestyle, as was mentioned. So instead, your options are to do more low impact activities like stretching, Tai Chi, yoga, balance training, etc. I did want to also point out that a lot of our focus here is the future when we think about the impact of exercise on cognitive functioning. And we talk a lot about the fact that we're looking at how things are going to be in a year. But I do want to also point out, and a lot of people I've worked with find this to be really hopeful and makes them engage even more, which is that you can see immediate benefits from exercise directly even after about 10 minutes. And so there's been a lot of studies that look at measuring memory prior to and after 10 minutes of exercise, and you can see that there's already a shift occurring in how quickly people are taking in information. So this is something that pays off right away and then also in the future. There's also been some really good data showing that the positive brain structural changes don't take too long and they last for quite a while too. So people, for example, who did aerobic exercise just for 6 months showed increased volume of those white matter tracts that I was mentioning into the frontal areas. And also the impact, it's kind of like money in the bank that continues to grow and maintain its value. People who, for example, taking you down here, who walked 6 to 9 miles per week had larger brain volumes 9 years later. So you can see that the brain benefits in an enduring way from that exercise. We also see reductions in what is called beta amyloid. In other words, this is a naturally occurring protein that starts to aggregate and glom the system in Alzheimer's. The good news is that exercise was lowering the levels of beta amyloid as well. So in other words, we're seeing cognitive impact, we're seeing structural impact, and we're also seeing impact from the standpoint of the proteins themselves that are implicated in Alzheimer's disease. So that's pretty cool. In other words, a number of endpoints show the benefit. Let's get to the heart of the matter here. So let's personalize your exercise. So the first thing I want to introduce, and this is just the model that I've kind of put together. Feel free to be flexible with it, but I put these pieces together to try to get to the heart of what's important for each of us as we think about exercising. And so I'm calling this the 4 W's plus bonus. The first we're going to work through is why. Why do you want better brain health? All of us may have a different reason for that, and it's important to really get specific about that. Step 2, who? Who do you want to be as you visualize your future ideal self, really picturing that? We're going to go through an exercise where you can picture that. Number 3 is what? What is your movement with joy? What is your choice? And I'm going to give you a little matrix that you can look at and choose from. Step 4 is when. We know that in habit change and motivation, that the more specific we can be, the more we can benefit from strategies. So if we can actually denote a time of day, Dr. Chin talked about he exercises in the morning, right? So that becomes a part of the routine. The more you can make it a routine, that is great. I would love to be able to exercise in the morning. I just did this morning and I'm like at 50% power in the morning. So I'm definitely an evening exerciser. So there's time of day is important. And then also duration. So deciding when and how long you want to move with joy. And then I found it particularly helpful to enlarge the motivation matrix beyond brain health. And so I like to personally think about how I benefit in other ways from exercise across body systems. And then in other areas as well, like sleep and stress management. So I call those bonus benefits. So, so much of the time, if we focus just on brain health, we can lose the forest for the trees with regard to the benefit. My tip here is we're going to just, again, work on a piece of paper, but I'm going to encourage you to spend the 15 minutes or so after our presentation to add visuals if possible. We are wired to be visual creatures that respond to not just words, but pictures. So we're going to go through some pieces here that if you can add pictures to them, like why do you want better brain health? Maybe it's your family. You would maybe put a picture of your family members right by step one. If you visualize your future self, your ideal future self, maybe you would put a picture of yourself when you were at that level that you're striving for again, or it could even be a picture of someone else who you're striving to be like. We'll get into that. But the bottom line is add visuals if you can after we're done with the presentation. So let's go into step one. The question here is, why do you want better brain health? So I'm actually going to back up here for a second purposely, and I want you to just write down, I don't want you to look at what I've got written down so far. I want you to write down why you want better brain health. And I'm going to do the same thing. I'm intentionally doing that with you right now. Okay. So I'm going to give you also a little bit of a list here of some other things that I've heard people say over the years, and you may also resonate with some of these. You can certainly add them to your list. It's better right now to even have more than one reason. You can combine them later, but don't feel like you have to have just one reason. There may be multiple reasons. And let's look at some of what other people have said to me over the years. I want to stay engaged at my highest level in my most important relationships with family members, friends, and colleagues for as long as possible. I have a family history of memory problems and I want to reduce my risk of Alzheimer's. Maybe for some of you, you may say, I have a history of mild cognitive impairment and I want to reduce the rate of decline and function at my highest, my peak level. Another thing that I've heard, I've started to notice some memory changes. I want to proactively enhance my future memory. Number 4, I want to be at the top of my game as I continue my life's work. Number 5, I need to be around to take care of my loved ones. I want to be able to do that as long and effectively as possible. And number 6, I know that my ability to manage my health, do my favorite activities, and live independently depends on having the strongest brain health possible. So those are some possible reasons, that one may want to enhance brain health. And if any of those connect with you, feel free to add those to yours that you have. In the interest of further personalizing this, though, let's move to step 2, which is who. Who do you want to be? So let's just take a moment again. This is designed to be in the moment, all together doing this. So, your next entry on your page is who. And let's take a moment. I want to just take a minute and have you think about a year from now. So we're going to be 2024, shortly before the holidays. Just take a minute, and if you could close your eyes, we'll all do this together. And I want you to imagine yourself at a really healthy, energized vision of who you are a year from now. So just take a minute to bring that to mind. What do you look like? What are you doing? How is your body looking? Are you hopefully you're smiling, but something salient that strikes you. This is your goal. This is who you want to be in a year. So 12 months from now. So you can see here, some aspirational images if you want to open your eyes, that may also strike you, but just take a moment and write down the features of who you want to be in a year. Okay. So that salient visual image, if you can find a visual image, this one is particularly important to try to find a visual image for. If you can find either a picture of yourself, or again, even if it's maybe someone else, whatever strikes you, whatever you feel you connect with, that is, when you look at it, you get motivated. It should have some grab to it for you. Some real connection where you look at it and you think, yes, that's exactly how I want to be. Let's take step 3. This is what. So what makes you move with joy? I have a list of things here that we can consider. But before you even, look at that, just take a moment and write down whatever it is. Many of you did this at the beginning, but what is it that makes you move with joy? When we talk about joy, we also talk about something called flow. Flow is a sense of loss of time. How many of you have, just by a show of hands, experienced that, where you lose track of time because you're doing something that you love so much? That's flow. You're so engaged. So write down whatever it is where you notice you move with joy and you lose time. Okay. Now for your consideration, I've broken up different types of movement into low impact, which is what we had been talking about, things that you can do that do not require significant cardiovascular or striking impact of the joints. And so those include things like gentle walking, water walking, and aerobics, water aerobics. Water, for those of you who like water, is really a fantastic exercising medium because it can give you cardio resistance. It minimizes the risk of falls. A lot of times there's other people there, so you get the social element, and then you can use music too, which is really helpful too. So gardening and yard work, yoga, Tai Chi, Pilates, bowling, golf, weightlifting, that can be low impact too. You can, have lower weights, cross-country skiing, biking. Now I have a little key here at the bottom. It's a little hard to see, but basically I have different letters telling you, is it aerobic? Does it involve balance? Is it competitive? Some people love to be competitive when they move. And so for those of you who do, look for the C's on this chart. You're going to see that there are several of these. What about involving a mental or cognitive activity? There's some really great research looking at exergaming, where we add in cognitive plus movement, and sometimes the social piece too. And you see that packaging can sometimes really impact in a positive way outcome too. And then of course, many people like to exercise in nature. So if nature is a motivator for you, I have an N by that activity. And then many people love animals and like to exercise with a dog or other animals, whether that's, on a horse or, being around animals can sometimes really bring out that engagement in that movement with joy. So I have P is denoted for pets here. And then I've got S for social, for those of you who really like to also have other people to work out with. Remember that what Dr. Baker said was, especially for individuals with mild cognitive impairment, having that social piece can actually be really helpful, where we can maybe have an accountability partner or someone who we're working out with and moving with joy with. So that social piece can be really key. But you don't have to get all the perfect answers right now. This is just a model for you to think through. Oftentimes what's right at the top of our head is what is the stickiest to us and the most powerful. So now that you've written that down, you can also think about intensity level. So again, use your current intensity level to gauge future intensity. So if you're sedentary, if you're not really moving too much, you wouldn't want to choose necessarily to move into high intensity right away. Maybe just increasing it little by little. And then as you're able, going a little bit further. So the next question is when. We got to this already, right? Some of us are larks, are morning people. Some of us are owls. We're night owls. And many people are in the middle. In fact, most people are kind of in the middle. So when do you feel most alive and engaged? So let's write down when is our next piece that we're going to write on our paper, and write when you feel most energized. Most energized to engage in movement with joy. Okay. So that's usually the easiest part for people, because you kind of know yourself well when when you feel most energized. And again, this goes back to the idea, even if you are somebody who's more of a night owl, even moving gently in the morning, because again, any amount of movement is therapeutic. Don't feel like you have to stick just to when you're most energized. You can sometimes even do a modified exercise routine. So for example, I told you I went to exercise this morning. My trainer, he couldn't meet with me at the usual time. So he said, can you come at 6:30? I said, sure. So we worked at about 50% of my usual level. So I still did it, but I just didn't do it as intensely. So that's something to keep in mind. You don't always have to, even if you're moving and it's not at your usual intensity level, it's still therapeutic. Let's talk about bonus benefits. So these are those things, now we've gone through our 4 W's, that are meaningful to us, that we get with as a result as a bonus benefit of the exercise. So we're going to go through sleep, and we'll go through stress management and also healthier eating. Those are, again, impacted by exercise. But I also wanted to show you a little bit of an overview that I've found people respond to well, which is people sometimes just get really thrilled about the idea of impacting their brain structure. So any of these that strike you, please write those under your bonus benefits. So for those of you who say, I'm super excited about my hippocampus, I really want to, decrease the atrophy. And I love the idea that I can take that little curled thumb shaped structure and really directly impact it with my activity. I'm going to write that down because I get excited about the hippocampus. Angiogenesis, right? Those increased blood vessels that grow. Some of you might be really just fascinated by that idea that you get more blood vessel creation when you exercise. And so you might write that down. And so the idea is here, you're writing down that whatever it is that strikes you, that you get that spark again, and you go, yes, I want to exercise not just for brain health, but also because I want new blood vessels. I want those blood vessels to grow. I want stronger memory, for example. Many of us may write that down. I find this to be really, really provocative personally too, which is decreased inflammation and cellular aging throughout the body. So the strategies we're talking about are designed, part of the reason they're helpful for brain health is because they're helpful for the whole body in many ways. They decrease inflammation, they enhance metabolic functioning. And so the brain is one of the multiple organs that benefits. But some people really like to know, geez, I'm improving insulin signaling, I'm improving my immune response, especially after COVID. That may be particularly salient for you. So write that down if it is. And then other changes, improving sleep, mood, mobility, independent functioning, people wanting to maintain their independence. Exercise is a great gateway to do that. Quality of life, metabolism. So just take some time for a moment here to just look through, write down your bonus benefits. What here strikes you as a spark? When you read it, you go, yes, I really want that benefit too, from my exercise plan. Okay, so again, you'll have time to fill in more details later as well. But right here, you've got, do people want to hold up their list? Just show us what you've done so far, if you'd like. You don't have to get specific, but you don't have to show the actual details. But if you want to just hold up your list so we can see if you've been able to kind of follow along. I'm kind of looking through. I've seen multiple people holding up their prescription. Awesome. Their engagement plan. Cool. Awesome. So I'm going to go through very quickly here in the interest of time, the support for those bonus benefits. We talked about angiogenesis and increased blood vessel formation. There's a visual. Again, visuals are powerful, so you can see that. If you didn't already write that down and you go, wow, seeing that visual makes that really important, feel free to write it down. And again, because this is the foundation for the other steps, consuming healthy food becomes generally, you get a bonus benefit from the synergy of diet plus exercise. So that's where the C comes in. So again, exercise is that foundation. Again, we can go into any of these later if you have questions, but in the interest of time, I'm just going to kind of go through here quickly. Engaging in learning. People who are exercising, again, oftentimes are engaging more socially. Even if you're walking by yourself, generally, if that's outside or around other people at a gym, you're getting that social benefit. So this engagement is also improved. Keep in mind, there's no best cognitive activity, but a lot of the things you see on this list involve other people, you know, attending a religious service, visiting a museum. And again, we always have to factor in that social contact can make a big difference. And then lowering stress. Exercise is a great strategy. I've got it right here, right at the top of the list for lowering stress, lowering cortisol, knowing that this again lowers inflammation, and that can also be helpful with an overall anti-stress response. And of course, many times when we look at folks who are having difficulty sleeping, we find clinically that if we can just increase daytime activity, a lot of sleep issues sort of kind of really benefit directly. People fall asleep faster, they have a sounder sleep. And so a lot of my strategies in our clinic, a lot of our strategies, and I'd be curious, Dr. Chin, to hear, you know, what your observations are too. We use exercise strategically for sleep. And we don't call it that. We just say, you know, having more activity or having a daytime program that someone goes to, suddenly you start to just hear that sleep is better. One of the pieces and possible reasons why, if we look at the beta amyloid and the tau proteins that are associated with Alzheimer's, we see that better sleep, longer sleep promotes flushing of those proteins at a higher level. In other words, when we sleep, you can imagine that the janitor of our brain is coming and cleaning out those used proteins, right? We're all producing beta amyloid all the time as a natural metabolic byproduct of right now, we're all producing it. That's why Alzheimer's is so hard to figure out how to treat, because beta amyloid is a naturally occurring protein. But what happens is the garbage gets taken out at night. It gets flushed out of the system. The waste of that gets flushed out. And so when we are not sleeping well and we're experiencing insomnia, we have breaks in that flushing of the system. And so exercising allows us to keep that sleep oftentimes longer. So that can definitely impact sleep too. So I wanted to share with you one example. This is Jan, so you can see how she filled out her sheet. So you can kind of look at this. She said her why was, I want to stay engaged at my highest level. So this is somebody who she is optimized. She's an optimizer, right? She's saying, I want to be at the highest level possible. Her ideal future self is someone who's vibrant, active, smiling, and healthy. And again, Jan would put a picture of herself looking like that. What? My movement with joy is dancing with others in class at the gym. I also like to dance at home while listening to my favorite songs. So I want to put a big plug in for music here. Music is, again, we're looking for those sparks. People, almost everybody I've talked to has some type of music that they get motivated by. You can take it even further and create a theme song for your exercise playlist. I have a playlist that I use, and it's the same playlist, but hearing it puts me right into the mode where I've got to exercise. And it becomes an association. Let's use that part of our brain that creates associations between activities and music to our advantage. So make yourself a playlist, for example, or use a theme song to start your exercise regimen or your movement with joy, because that becomes really powerful. Actually, when you hear it, people just move into action then literally. Morning is my time, usually from 10 to 10:30. And then bonus benefits. So Jan wanted not just better brain health, but she wants to sleep better. She wants to improve her metabolism, lower her stress, and cancer also runs in her family. So she wanted to reduce her risk of cancer, and exercise has been shown to help with that too. So the best time to plant a tree was 20 years ago. The second best time is today. So we've all got some seeds here that we can move forward with. And I love the idea of having there be power in this group. And so would everybody, you know, as many people as possible be on board with the idea that we're going to move for 5 minutes with joy today, as long as you've got medical approval to do so. So if so, just give a thumbs up. I'll give a thumbs up. Because then there's power in that, right? And moving with joy, knowing that other people are doing it makes it better too. Now, if you're interested in just tracking this a little more precisely, I've got some tracking sheets in my book, but you're more than welcome to kind of use those and copy those from there. But let's leave this up, because this is really the most important thing right now. And we have some time for questions as well.
So Michelle, I just want to say, wow, that was such an easy tool and a visual tool and a personalized tool to really see how you can build an activity program that is just very person-centered and applicable to each of our daily lives. So thank you for that. It got me thinking a little bit, and maybe, I don't know if you or Nate have any, or you, Dr. Chin, have any insight into this, but what I have seen in some of the work that I have done with folks living with mild cognitive impairment and their support partners is that exercise anecdotally seems to be the piece that leads to, oh, now I want to add like maybe changing my diet a little bit more, or you know what, there's some other ways that I want to incorporate some stress management tools. But it has seemed that exercise is kind of this jumping off point to doing other things more prominently than starting with stress management or starting with you know, dietary changes. Is there any information that takes that anecdotally to something a little bit more concrete, or is that information just kind of observable from my perspective?
Yeah, I mean, I've definitely observed that too. And that was part of, I think that is, you know, a byproduct of action in some ways, right? Because movement is action, and there is a pretty rapid benefit from the standpoint of endorphins and attention and memory that we do see an immediate improvement in. And so I think that it extends itself to those other areas naturally. I'm aware of research that suggests that, again, there's the synergy, but not necessarily from a causal standpoint, but I definitely have seen that also clinically all the time. One of my favorite things, I just saw a patient yesterday. I have to share this with you because it is so interesting. I had seen him for a repeat evaluation for neuropsych, and he was really depressed. And he also has been on Ozempic. He's been trying to lose significant weight, and he is having some major challenges with that. And he's very concerned about his memory as well. He has mild cognitive impairment. And I oftentimes will do the evaluation, and then before I'll schedule the feedback, like maybe a week or two out, and I'll give an assignment oftentimes for like a tailored assignment to have that person see if it works, and then we modify it, the feedback. And so his assignment that he shook on, and we actually shake hands on it, is that he was going to walk 1 lap at the Y every day, as long as he was medically approved to do so. He got medical clearance to do that. And he came in yesterday, and he was literally like motoring down the hall in front of me. And I said, wow, I noticed the difference. He just seemed clearer. To your point, he was more engaged. His mood had shifted. I mean, there's so many positive benefits that come from an activation standpoint that he was making other changes in his life right away. It just seems like the natural foundation for engagement and other things. Dr. Chin, have you noticed that clinically as well?
I have, and there's a book called Atomic Habits by James Clear, who uses the phrase a keystone habit. And what I like about that is that all of these habits are important. So, Dr. Braun could speak in her book, she speaks to all of the evidence base for multiple, what we call brain health pillars or key habits. But some of them can lead to other habits becoming easier or reducing the barriers and engaging in those other habits. And exercise tends to be one of those. And I think that's because everything that Dr. Braun just said, and people's moods and their motivation and that movement and action, I haven't come across any sort of paper showing that exercise itself has been evidence-based as the habit, but I think clinicians see it frequently. And I would say that for me, exercise certainly leads to other habits, and so does sleep. And you can see how important exercise and sleep are related, as Dr. Braun pointed out. And so we have to be in the right state in order to engage in the things that are beneficial for our brains and our bodies. And certainly being rested is one of those, but then also someone who does engage in physical movement tends to be doing some of these other things, or caring about the foods that they eat or the people that they socialize with. And so I think many people in the podcast that I've done, I always ask people, what is it that you do? And everyone ultimately will say exercise. And I think that is one that it's achievable for us, and it's very personal, and we can make it fit our own lifestyle. So I do think exercise is a foundational one.
Thank you guys for your feedback on that. We have a question. What has been the best motivator you have seen for getting your patients to be physically active? And that one can be to both of you.
Yeah, I mean, it really is personalizing it like this. It's getting to know them, and it's then speaking to how what's important to them could benefit. I think and I will say too, the light up moments tend to be when the information is made portable and visual. So that's where, like, this is the hippocampus, like, most people will say, yeah, exercise benefits everything. And they'll have kind of a global awareness that that's the case. But when they learn about the hippocampus, for example, I'd say that's a big motivator for folks. And they're like, really? You can grow that? Like, you can make that more dense? Wow. I mean, you get that wow factor. If you can get the wow factor, I think that's a piece of it. I would also say, though, that creating a behavioral contract with the person is often very helpful, kind of like I was sharing I did with that patient yesterday. And I know it might sound odd, but shaking on it or saying, would you give me your word that you would do that? That seems to have a power to it, because people take that seriously. If they tell you, you could say, like, here's the plan, and they could be like, oh, that's so exciting. But when you take it to a personal level and you say, would you promise me you would do that? Or would you send me an email and let me know you did it? So you're closing the loop. So creating some element of wow, and then creating some accountability with the caregiver. So I will tell you that the patient I saw yesterday, his wife started walking with him too. Now she has emphysema, so her walking speed is very slow, but she was doing it. So if we can create that social contract in some way, and even for those folks who like exercising by themselves, who prefer the solitude of exercise, even having accountability, I think, could be helpful with somebody else.
Thank you so much. One thing I wanted to add is I don't know about for other people, but for me, even if I'm doing something that brings me joy, that's a form of physical movement. Sometimes I can still get a little mentally down on myself because it's harder than it used to be, or I feel out of breath quicker, or I need to take more breaks. And, my head can be a chatty place about like, oh, you should just stop. And one of my friends gave me this phrase to use that's been really helpful. So when I start to feel that way, like pausing and saying, I'm curious what my body can do. And that's been really helpful for me to like have that mental shift. Mind you, I have to remember to like pause and say that to myself. But the times that I do that, it really helps me then get more engaged. Like, yeah, let's see what can, this is fun, and helps me re-engage with it. And that was just really helpful for me. So I wanted to make sure to share that with others.
I love that. That's great. I'm writing that down because I love that. I also love the phrase action precedes motivation. I know that's a little bit kind of like wordier, but I don't Nike is onto something when they say just do it, right? I mean, that's behavioral activation. I mean, that's been shown many times. And so I think the other thing that I think sparks people is knowing they can move with joy for 30 seconds. It does not have to be, 5 minutes even, but we want to get the foot in the door with even just a few, more seconds of motivation, of movement under motivation, because that leads to more usually. So that's another sort of igniter. Dr. Chin, have you seen anything? I'd be curious, because I know you specialize in, working with older adult population exclusively, in anything you've noticed.
In my clinic, now granted, I work in a memory clinic primarily, but I will say for the family members and partners of my patients in a memory clinic, the idea of optimal health, what that is for your body, speaks to function. And I think when we think of our qualities of life, it really is speaking to our abilities that we engage in each and every day. And movement helps sustain those. We know that as we get older, we lose some muscle mass. We have changes in how we walk. There's always the risk of falling. And the more we engage our body in whatever form, particularly things like chair yoga, walking, going up and down stairs for those that can, that strengthens our body, strengthens our bones. And that was listed under one of Dr. Braun's extra bonus questions. And I think that really speaks to people who are getting older but want to live in that optimal state. And I think that is a very powerful message that many people take on. Another one that I see a lot is stress. And there's this myth that once you retire, your chronic stress goes down. And I think those that talk to older people recognize that is not true. Certainly chronic stress is present for all of us, and sometimes it's even higher as people are getting older for various reasons. And physical activity, Dr. Braun mentioned, you release your natural endorphins. And that is a way of addressing the blood pressure, inflammation, and stress specifically. And we get so used to living in a heightened state of stress that it becomes normal, but it's not normal. And so once a person starts engaging in movement and they recognize, oh, I can actually feel better than what I thought my baseline was, then I think not that I want to use the word addictive, but it becomes this beneficial response. And I see more and more people really enjoying walking in particular as a result of this stress reduction that comes from moving with people, if you go with someone else. And it's really incredible. But it is something like Dr. Braun said, you want to close this loop. You want to be held accountable to this goal. And so whether that's a family member or someone else, making sure that you actually continue to do it.
I'd like to, we're coming close to the end of our time, but I would like to address something that was in the video of this idea that people living with mild cognitive impairment have a little bit more of a challenging time of being able to maintain some of the activities that they're doing without a support in place. And so I am not sure if this exists but is there any sort of services within the health system or even in our communities where personal trainers at the gym might fit the bill, but they may not have a solid understanding of what the actual barriers are? Or, when I think about like health coaches or like the virtual services through something like like a Noom app or somewhere where there's this more kind of a structured support that provides a little bit of reflection of, okay, how did that feel to do that activity? Helping to look back on, this is where you started and here's where you are today, and it provides a little bit of that motivation. Does anything, is there a service like that exists that's available readily, or is this something that is like we could think big about what are some of the infrastructures that could be developed to help deal with some of these barriers?
I think you're addressing a gap in the healthcare system with that. But I would say in my clinic, for patients, whether you have mild cognitive impairment or it's earlier and it's something we call subjective cognitive decline, where you're not having impairments on testing, if there's a need and you have to have a justifiable need, I will make a referral to physical therapy. And I think physical therapists are amazing, occupational therapists too. But in this regard, physical therapists can work with people on how they walk, on their balance, on how they move in a safe way. I mean, many physical therapists end up actually doing personal training too. And so they have the skills, but they also have the medical knowledge and experience. They would not be doing this like a personal trainer, daily, weekly for a year. They would probably do 1 session, 2 sessions, but I have utilized that when I've been able to show the medical need, and my patients have benefited from it's more education and physically walking around and showing a patient how to move. But I don't think, I mean, if a person could afford, a personal trainer, yeah, that would be wonderful, or a health coach. But I don't see anything, at least in my experience in the healthcare system, that would help bridge this, what we know is important, from how to actually demonstrate it and support people in doing it.
Yeah, I would agree. I think a lot of that comes down to that personalization piece too. As Dr. Chin is saying, there's that subset of patients who respond really well to that, who need that kind of granular instruction and really benefit because they've got that one-on-one. For folks who were trying to fill that gap, we could use, Silver Sneakers is another type of program that's available at the Y, and it's free for most older adults. There are some growing programs there. Part of my next goal here is I'm developing an exercise program that embeds cognitive engagement as well. I'm actually getting an MBA right now focusing on creating, more of an exercise for individuals who are having cognitive changes down, that's my pet project down the road. I'm working on it right now. But to your point, to try to address some of these gaps, I would also say that the use of routine is, we want to bank on the non-hippocampal pathways. And the motor pathway and the pathway of routine is one that we can double down on, because if we're creating a movement-based routine where as soon as someone gets up, they do this before they reward themselves with maybe having breakfast, so that there's a contingency based in, that can actually be really helpful, because then you're creating that sense of momentum. How many of you have heard of the app called Forest? And just by a show of hands, because that's another thing that sometimes I use with folks who have the ability to like engage in a task, but they really want a little motivator. I'm going to show you a little screenshot of it. You basically download it, and while you're engaged in whatever task you're doing, it grows your tree. So it starts out with no tree, and then it adds leaves. And it's designed more for like focusing on on an app, like not getting off of, onto another app, but you can set it in motion while you're doing the exercise. So your tree grows and grows and grows. And then if you stop, your tree starts to lose leaves, and people do not like to kill their trees. So they get really, it becomes a visual motivator. And then look what you can do. You can grow your forest over time. So it's a cute little app that actually is based on the Pomodoro technique, which is this technique that, once you're in motion and you start to do something and you get that contingency, it can kind of reward you a little bit. So that's another fun one, but I think we're going to see more and more of those kinds of apps.
Boy, thank you guys for your insight on that. That's been really helpful. We are 1 minute away from our time ending. Bonnie, Michelle, I really want to thank you for all that you have shared today. This was an amazing presentation. There's all sorts of wonderful comments about how helpful your talk was today. If you could, before we leave, put the name of that app in the chat for people, that would be wonderful. Oh, thanks, Bonnie. And Bonnie, do we have some things that we want to wrap up our time with? Some announcements, some things that we'd like people to know about?
Yes, we definitely have some announcements. Thanks, Jen, and thank you so much, Michelle, for everyone who attended today and everybody who is on our Google listserv. You will receive an email that has the PowerPoint. It will have the name of Dr. Braun's book. It will have the other book that Dr. Chen referenced. It will have a couple podcast episodes that apply to what we're talking about. I'll also include the information for Forest in there as well. And then 2024 event dates haven't been released yet, but I know Dr. Chin and Jen are going to be working on that. So stay tuned for some information in your inbox on that in early 2024. And then I know one of our community partners, Karen, a dementia care specialist in Rock County, has a program she's doing via Zoom starting in 2024 for caregivers or care partners. And Karen, did you want to say a couple words about that before we wrap up?
Sure. So in conjunction with the two DCS from Dane County and myself, we are going to be doing a monthly program, a monthly series called Caregiver GPS, and it will be virtual beginning January 18th. So it's the third Thursday of every month from noon to 1. We tried to cover a time that for folks that are still working is, feasible. And there's a progression of topics. So some people may want to jump on, you don't have to come to all 12. But if you want more information, I'll put my contact information in the chat, because we'd certainly extend an invitation to anyone who is interested in joining us.
Thank you very much, Karen. Appreciate it. So Karen will put her information if you're interested in hearing about that. This recording will be available. I can't give you an exact timeline, especially due to the upcoming holidays and people taking time off, but we go through and our wonderful communications team edits the video. So we take out people's faces outside of the presenters, that kind of thing. So in early 2024, the recording will be available. We will send you a link to that, as well as on our website, there is a page that is the Healthy Living with MCI page, and all of the recordings are housed there. You can also find them on the Wisconsin Alzheimer's Disease Research Center's YouTube page. One thing before we go, please go ahead and take the survey of today's program. That helps gives us feedback, and also on how willing you are to maybe implement or change your behavior. We love to hear that from you. And so thanks again for everybody involved. Thank you, Dr. Braun and Dr. Chin and Jen, and it's been a pleasure being here with all of you. Have a great day.
All right,
Thanks,
enjoy your
Bonnie.
5 minutes of movement with joy today. We'll all be doing it together.
Here, everyone.